The pelvic tilt is one of the first exercises I do with many patients with back pain to reintroduce movement into their spine. We want to stay within a non-painful range of motion and not push into anything that is painful or uncomfortable. For those not in pain, this can still be a great way to train strength and coordination of some of the muscles of the lower back, the muscles that are important for our posture and power during everyday life and sports. If we imagine our pelvis as a bowl of water, anterior pelvic tilt means that we're going to pour the water out the front of the bowl, kind of like we're trying to stick our butt out. Posterior pelvic tilt means that we're going to pour the water out the back of the bowl, like a dog trying to tuck its tail between its legs. We want to isolate this movement as much as we can to the lowest part of the spine and not have a whole lot of excessive movement through our mid or upper back. So let's show you how to do this from a few different positions. Lying on your back is the first position I teach my patients how to do a pelvic tilt. So from here, what we're going to do is we're going to anterior pelvic tilt, which means that we're going to kind of stick our butt out and arch our low back off the table. And again, we only want to go as far as we can without any pain or discomfort. So if we get a little bit of pain, kind of stop right on the edge of that discomfort and don't push through it. And then we're going to do the opposite. So we're going to posterior pelvic tilt and flatten our low back to the table. And then we're just going to alternate between those two positions, trying to arch the low back as much as we can, trying to flatten the low back to the table. The second way we can do this is from our hands and knees. So from here, we're just going to do the same thing. So we're going to arch our low back, and then we're going to tuck the pelvis under, posterior pelvic tilt. During both of these, we want to try to keep the motion as close to our low back as we can. We don't want to be rounding and extending through the whole spine. We want to focus right here in the lowest part of our back. The last variation we can do is from a standing position. So cross your arms on your chest, slight bend in the knees and the hips, and then we're going to anterior pelvic tilt, stick our butt out, posterior pelvic tilt, tuck that tail between your legs, alternate between those two positions.